Hello and welcome to Askimo TV. I'm talking today to Dr. Nisith Sheth. Dr. Sheth is a consultant dermatologist and dermatological surgeon at St. John's Institute of Dermatology in London. Hi, Dr. Sheth. How are you?
Hi. Good morning. Very well, thank you.
Great. Dr. Sheth, let's talk today about some of the differences between teenage acne and adult acne. So what does the term acne refer to?
So acne essentially means that you could get lesions on the skin, usually on the upper face, which are due to clogged pores. So you can get comedones, which are open or closed, so flesh-coloured or black little pimples, or pustules, pus-coloured, pus-filled lesions on the face.
Is there a difference between adult acne and teenage acne?
So there are a number of differences. Essentially, adult acne can either be acne which started in teenage years and then progressed into the adult years, or it can be adult onset. Adult onset acne is usually much more common in women, and there are probably many hormonal factors that are associated with it. There can be an imbalance between male and female hormones, which lead to the onset of acne in adulthood. Other factors that may contribute may be, for example, hormonal medication such as the oral contraceptive pill, the use of cosmetics, which obviously often happens later in life, and often the distribution can be different. So, for example, hormonal late onset acne in women often more commonly happens in the lower aspects of the face, around the jawline and neck, and often involves more papules and pustules compared with teenage acne, where there may be more comedones, for example.
So tell me about who would be at risk for teenage acne, or can any teenager get acne?
Any teenager can get acne. In fact, it would be quite unusual not to get acne in the teenage years. Probably about 90 or 95% of teenagers at some point will get acne. Interestingly, it's more common in the Western world and less common, for example, in sub-Saharan Africa. And there may be many different factors, genetic, dietary, environmental, that may be contributing to that.
What would be the treatment process for teenage and adult acne, and would it differ?
Essentially, the principles are similar, but there are some differences. So for teenage acne, for example, there are a range of different treatments, ranging from topical treatments, so cream-type treatments, to oral therapies and other types of treatment as well, such as peels or laser treatment. But the mainstay of treatment is initially topical treatments. So, for example, good cleansers, use of bacteriostatic agents such as benzoyl peroxide, topical antibiotics, and topical retinoids. In adult acne, these can also be used, but the skin later on in life can often be a bit more sensitive to these products, and sometimes they can't tolerate such harsh products. All treatments include oral antibiotics and anti-hormonal treatments, and usually adult onset acne particularly in women, may respond well to anti-hormonal treatments. And then probably one of the most effective, but also one of the treatments with the most potential side effects is Accutane or Roaccutane isotretinoin, and these can be used in all groups.
Is acne, whether in a teenager or an adult, curable and preventable?
Acne isn't curable per se, but it is highly treatable with a lot of the medications that I've already mentioned. And in many people, acne does come out of the system by its own accord over a period of time. So most of the treatments are there to suppress a lot of the symptoms, and to make the appearance better for the patient.
and preventable? Could a teenager prevent themselves from getting acne?
Yes, there are many things that a teenager can do. For example, try not to pick or squeeze spots. It's important to cleanse and remove makeup properly, because these sorts of things can block the pores. Use oil-free substitutes, for example. Try and avoid scrubbing too hard, as it can irritate the skin, make the acne worse. So there are a number of things that can be done to prevent outbreaks of acne.
And just to end off, what lifestyle, whether it's dietary, for example, should a person with acne make? What lifestyle changes?
Some of those things that I'd already mentioned, so for example, cleansing the skin, getting into a routine where you're doing that. At the moment, there's no strong evidence of a dietary link with acne, although there is some weak link with, for example, dairy in young adults. That said, I will not advise avoiding these completely, but if you feel strongly that there may be a food correlation, it may be worthwhile doing a trial, exclusion trial of certain products, for example, dairy for a short period under supervision, medical supervision, to see if it does improve your conditions.
Thank you, Dr. Sheth. Thank you so much for talking to me today.
You're welcome. Thank you.